Very good day to you and welcome to Health Talk, your weekly dose of analysis of current health issues. We broadcast live from Johannesburg in South Africa. I'm Dr. Sello Daoud. In today's show, we discuss supplements in sports. But before we do, let's take a look at current health stories making headlines. Health Minister Aaron Motsoaledi says he's concerned about the absence of infectious control nurses at some hospitals. The minister was speaking at a summit on antimicrobial resistance in Johannesburg.
Antimicrobial resistance, or AMR, is a resistance to a drug that was originally effective for treatment of infections. In South Africa, drug resistance is becoming common. The health minister says there's a need for more infectious control nurses.
My heart is breaking. I was made to understand that there were infection control nurses before, but when OSD, occupational specific dispensation, was introduced, I understand this category of infection control nurses was not included, so they left it. And I think that's a disastrous happening.
The minister has spoken against the use of antibiotics for routine illnesses. He called on health professions councils to reprimand doctors who prescribe antibiotics indiscriminately.
No country is immune or is an island, just as Ebola is moving from country to country. So these resistant strains can emerge from anywhere and spread everywhere.
Earlier this year, the World Health Organization kick-started a global effort to address the issue. Hasina Gori, SABC News, Johannesburg.
Okay. International communities are scaling up efforts to fight Ebola. The World Health Organization estimates that there'll be about 10,000 new cases by the first week of December, if the weekly rate of newly reported cases continues unabated.
Since the Ebola outbreak 8 months ago, more than 4,000 people have died. But the World Health Organization says this number may be underreported. Obama says the number of countries which have the capacity have not come to the party. He's called for more aggressive approach to tackling the virus. The U.S. has sent troops to assist with the building of an Ebola center in Liberia. The World Health Organization shares the same sentiment. It says some of the countries affected cannot solve this problem alone.
There is a need for more resources to build treatment centers, and also people to be able to work in these countries, to be able to take care of patients and carry out basic public health.
The UN's Ebola mission chief says the world is falling behind in the race to contain the virus. Sierra Leone, Liberia and Guinea are the worst affected.
We are not having a social problem. It's affecting our agriculture, it's affecting, our family lives. We are having a lot of orphans, single or double orphans. We are having widows. We are now having child mothers, who are overnight have become parents, after maybe they've lost all their parents and everything.
Survivors of an epidemic that killed more than 200 people in Uganda 14 years ago have offered psychological support to sufferers in West Africa. Lehana Toteti, SABC News.
Okay. Now, as you've seen earlier, American military operations to fight Ebola in West Africa are unfolding quickly. And for a discussion on the U.S. military deployment to combat this deadly virus, we're joined in our Pretoria studio by Stephen T. Smith from the U.S. Department of Health and Human Services. Stephen, welcome to Health Talk.
Good morning, and thank you.
All right. We've seen deployment of, soldiers to Liberia. Could you perhaps just, before we talk about, what it is exactly that they're doing, perhaps give us an update on the current situation insofar as the number of U.S. nationals infected by Ebola?
Well, our domestic situation is we've had 3 cases, and we have a response underway domestically, and we have a response underway globally. We see this as not just a regional problem in West Africa, but a global problem and a global emergency, which is why we've made it a top priority domestically and internationally to combat Ebola.
Mm-hmm. Now, perhaps then let's get on to Liberia. What was the rationale in sending troops to the region? What exactly are they going to be doing there?
Well, as you know, this outbreak is unprecedented, and we have had, at the request of the host governments in West Africa, medical and technical professionals deployed since March to try to do what we normally do for an Ebola outbreak, which is to get ahead of the outbreak, to isolate the cases, and to make sure we treat people compassionately, and we do the contact tracing, all the things that we've done before and we will do again. Unfortunately, in this outbreak, it has gotten into urban centers, and it has really gotten ahead of the response. So what we are going to do from the United States point of view is deploy an unprecedented effort to try to get ahead of the outbreak. And we're doing this in partnership with a whole international coalition. But what we have to do is contain the outbreak at its source in West Africa. We also have to make sure we mitigate the economic and other consequences, that we build an international coalition, that we strengthen the ability to respond to outbreaks. But what we've done now is made a commitment not just for public health experts, but for military experts. And we're looking at more than 3,000 troops going in to set up treatment centers, to set up laboratories, to set up training centers. They're already on the ground doing this work. So we've already brought in 200 tons of equipment. We're setting up 50 safe burial teams. We're doing all of the things that need to be done, but at a much larger scale. And so the military that we're bringing in there is uniquely positioned to do all of that logistical work. What we need to do is do this in partnership with the international community. We are, in recognition of the crisis, ramping up our response, but we need the whole world to ramp up their response.
Now, there's criticism leveled at the international community that, in fact, the response has been quite slow. And in fact, specifically with regards to the US, some quarters say that it's only when some US citizens were infected with the virus that we saw action. Now we're seeing lots of soldiers deployed to Liberia. Your response to that?
Yeah, that's absolutely inaccurate. We've had medical professionals from the Centers for Disease Control and USAID in countries since March, working closely with the host government and with the WHO and with very important organizations like MSF, who are really doing the work on the ground. And we've been working closely with them for months now. And the major increase to bring in the U.S. military was announced by President Obama a couple of weeks before we had our first case in the United States.
All right.
Now, the cases in the United States do raise even additional attention, but the response has been in advance of that.
All right. I'm afraid there we're going to have to leave it. And all the best in your efforts to assist in Liberia. And thank you very much for your contribution. All right.
Thank you very much.
That was Stephen Smith from the U.S. Department of Health and Human Services. Now, the Ebola outbreak has claimed more than 4,500 lives, and the number of new infections is doubling every 3 weeks. MSF says that despite promises from various countries to help stem the deadly virus, the affected countries are still in dire need for assistance from the international world to help contain spread of this deadly virus. Take a look at this insight.
Doctors Without Borders, a medical charity that has been at the forefront in the fight against Ebola in West Africa, said it was reaching its limit and urgently needed other organizations to step up the efforts against the deadly disease. The organization currently operates 6 centers in Guinea, Sierra Leone and Liberia, with a total of 600 beds. Its personnel on the ground have grown from about 650 at the start of August to about 3,000 currently. Field workers from the international aid organization MSF returned to South Africa last week after having worked in Ebola-stricken countries in West Africa. They say far more people have died of the disease than the World Health Organization estimates. Speaking at a press conference in Johannesburg this week, a South African pediatrician who had been stationed in Sierra Leone since May said she believed people in the countries worst affected are not reporting all Ebola cases.
The community has a little bit of misinformation. That's getting better as the epidemic's progressed. But people just have very, very little access. And parents are really terrified to bring their child to hospital. They're scared that they catch Ebola. The government has set up police blocks, so people who are crossing on major roads get their temperatures checked. People are really scared of what will happen to them if they are found to have a temperature.
According to Doctors Without Borders, The fear and stigma associated with the virus means that 40% of patients treated by MSF who survive are often not welcome back into their villages.
We have to take the patients back to their villages ourselves, and we have to show the villages that these patients are cured, they haven't escaped, and it's safe to share your village with them once more.
According to the World Health Organization, the Ebola epidemic is still spreading, and projections show that there could be 5,000 to 10,000 new cases a week by early December. MSF is one of the main defendants to this Ebola outbreak, and because there has been no real response on the ground as of yet. South African Health Minister Aaron Motsoaledi announced the Ebola Response Fund, which is meant to support the health and humanitarian efforts in West Africa. The United Nations has also set up a global Ebola response. The Canadian government has committed $35 million to the World Health Organization and the UN humanitarian aid groups working the affected regions. MSF says despite the promise from various countries to help stem the deadly virus to date, few pledges have translated into concrete action on the ground.
We're not saying that MSF is alone for beating our own chest and beating the MSF drum. Where is WHO and where are other actors? To be very honest, it's they're not there.
All right, for a further discussion on Ebola, we're joined in our Pretoria studio by Sharon Ekambaram from Doctors Without Borders. And Sharon Ekambaram is going to share with us her personal experiences of being in the region herself and, to kind of give us perspective as to what has been happening in the region. Do we have Sharon in Pretoria? Sharon, welcome to Health Talk.
Thank you, Dr. Matang.
All right. We've seen in the inserts, the challenges in the region. Do you perhaps want to share with us, from the MSF's perspective, what actually is the situation like in these regions?
Well, as you probably know, MSF has been in West Africa since March 2014. And, we've been since then making efforts to try and contribute to bringing this epidemic under control. But unfortunately, we are still running behind the epidemic, which means that every day there are still a high number of newly infected people with Ebola. And as long as that continues, we are unable to bring this disease under control.
From your perspective, though, what is the main problem with regards to containing spread of this virus in these countries?
I think we have to look at the state of these three countries. It's not accidental that this epidemic has reached such proportions, particularly in Guinea, Liberia, and Sierra Leone. You are looking at countries that have depleted health systems, if they exist at all, incredibly impoverished communities. Freetown, Sierra Leone, people live in overcrowded conditions. And these are all, make for the prime conditions for the way in which this virus is being spread out of control. So unlike Europe and America, where there are resources, the countries have the resources and the ability to contain any infection of any individual. It's these countries that need our undivided attention and support in bringing this disease under control. And unfortunately, poor people are bearing the brunt of having healthcare systems that are unable to provide them the protection and the dignity that they deserve.
Yeah. Talk about international organizations, you mentioned now Europe, America, and so on. What sort of, in your opinion, what sort of support has been afforded to this region by these, superpowers and international organizations?
I think it's, it's well documented that the response came too late and it was inadequate. Our field teams are beginning to see that the intervention is reaching the ground, but it is still very slow, and in proportion to what is required, it's still inadequate. And, you know, I think the fact that we now have the UN mission for Ebola emergency response, something called UNMIR, the media has to be focusing its attention on this structure and asking for accountability. On a daily basis, we need figures, we need facts. The target for this structure is January, we're going to have 100% infection control of any new infection, and we're going to have 100% effective burial of anyone who's died of Ebola. Now, the job of the international media is to hold the structure to account and ask for figures to demonstrate, because that's what's failing at the moment. We're having incredible pledges being announced, huge publicity that countries and international community is getting, but where is the accountability to show step by step what is effectively being done on the ground to bring this disease under control and to ensure that we're saving people's lives?
I'm afraid we've run out of time, but are you hopeful for the future?
You know, right now I'm not very hopeful. I think unless we identify that the problem is in West Africa, it's not in America, it's not in Spain, it's not in US, it's actually in these three countries, and every effort from the entire world, from the African Union, from South African government, from all states, we have to be focusing our attention to these countries. Then there will be hope. But right now, I'm cautiously hopeful.
All right, okay. I'm afraid there we're going to have to leave it. And I want to thank you very much for your contribution and wish you well. And of course, thank you, for the good work that you continue to do in the region and elsewhere.
Can I make one appeal to the audience in how we can support the effort in
15 seconds, sure.
Okay. So if you want to support what MSF is doing in solidarity, you can SMS JOIN to 41486. And that will be a 15 Rand a month contribution to enable us to continue to do what we are doing. Thank you very much.
All righty, thank you. We're going to leave it there. And yeah, that was Doctors Without Borders. Now, in response to media reports that South Africa may be hosting the 2015 African Cup of Nations football tournament, SAFA President Dr. Denny Jordan has announced that there are no plans for South Africa to host this tournament. So fears that the Ebola epidemic in the West African region may be imported into South Africa if this tournament were to be held here need not be a concern. He further reiterated that this deadly disease must be fought collectively and that all countries must take care of this pandemic by putting strict measures in place. Coming after the break is our main topic for today, nutrition and supplements in sport. We will learn all about use of supplements in sport, the supplement industry, and how nutrition can help support high performance in sport. Stay with us. We're back after the break.
SABC News delivers stories that unify the nation
in many ways. Stories that inspire us
to see the world differently, appreciate
and celebrate our diversity.
And mostly, they make this place a better country to live in despite our color, beliefs or culture.
I
am
Hendra Raghunath.
Tabile Wato, Lulu Gabu.
Join us every day
as we provide updates on
local and international news
straight into your home.
We are SABC News.
Cameroon's economic capital, a unique art collection is on display. Titled Yesterday's Memory, Tomorrow's Memory.
We are trying to preserve this heritage despite many things that have changed in the designing, embroidery and the model.
If I'm telling you, you don't like it, I call it defeat.
Join Musam Khalipi on Afro Showbiz every Saturday at 19:30 CAT.
SABC, sharing 20 years of inspiration.
Okay, you're watching us on SABC News. Welcome back. Now, sport is a major global industry generating billions of rands in sponsorship, media rights, and other related businesses. Now, as the business of sport continues to grow, so is the use of supplements, especially amongst young budding athletes. The big question, though, is, do nutritional supplements actually help athletes perform better? Are there any benefits or even dangers associated with the use of nutritional supplements? Take a look at this insert produced by Tamim Bogan.
Many sports supplements contain substances that are associated with significant health hazards. Athletes consuming such supplement products may jeopardize their sporting status and their health. Athletes like Lebogang Palula, who was given medication contaminated with a banned substance without being aware by someone she considered a father figure, almost shattered her career after she tested positive for a banned stimulant, methylhexanamine, and served a 6-month ban from the sport. There is an alarming increase in the number of reported adverse health effects and positive tests. Josta Dladla faces a bleak future after South African Institute for Drug-Free Sport confirmed that the Kaizer Chiefs player had returned a positive test for a banned stimulant late last year. It is time sportsmen and women realize that supplements may be contaminated with banned substances and that this can affect their health in the long term. Public concerns over the use of drugs in sport causes significant damage to the sport industry, with consequences such as reduced attendance at sporting events.
Well, the issue is that athletes really face a problem. Supplements can be contaminated, and you just cannot tell from the outside if that's the case or not. I think athletes have a right to use supplements, as anyone in society. Supplements are a part of society. Yes, it is a problem that supplements can be contaminated, and if you like sports, you should try and do something about it.
Athletes are known to use substances, commonly dietary supplements, to improve their performance. Some supplements do have an effect on athletes' performance. However, that effect is usually slight. Most supplements tend to benefit only a specific athlete in a specific situation. The real challenges come to the amateur athletes, who don't have someone pointing out which products are safe and which are not.
Contamination is a real issue that obviously with the latest batch of European testing showing a 1 in 10 risk for random supplements selected from the industry, that's a very significant risk.
Supplements should be taken when there is proof that the diet cannot provide quantities of nutrients needed. A nutritional evaluation by a dietitian with sport nutrition experience should determine if any deficiencies are present in the diet, and supplements can be taken accordingly.
All right, for a discussion on supplements, we're joined in our Johannesburg studio by Martin Dewey, 4 times South African national bodybuilding champion and World Commonwealth medalist. And Martin is also author of 2 books, Drug-Free Muscle Training, and the other one, they're Slowing Down Father Time. Right. We'll come back to you, to Martin, but in our Cape Town studio, we have Dr. Amanda Claassen-Smithers, who's a registered dietitian and exercise scientist. Amanda is also consultant to the South African Institute for Drug-Free Sport. Amanda, welcome to Health Talk.
Thanks, Dr. Matuung.
All right. And to you, Martin, obviously.
Thanks so much for having me here.
Right. Now, obviously, the big thing is about contamination of supplements and, you know, young athletes testing positive to banned substances and so on, as we saw in the insert. But perhaps let's just start from the beginning, as in, you know, basic stuff, definitions, because there are various supplements, food supplements, ergogenic aids, vitamins and minerals. Do you want to perhaps just go through what's available out there in the market, Dr. Claassen-Smithers?
Well, the big problem is that the term nutritional supplements are actually so wide.
Yeah.
Any supplement that is sold either as a sports supplement or ergogenic aid or a health supplement or a dietary supplement, they're basically all grouped under nutritional supplements. And as such, for the nutritional supplement industry, there's absolutely no regulation at the moment, no legislation controlling it. And as a result, the supplement manufacturers and retailers can make really any claim, put anything in a product, and if they sell it under the umbrella of a nutritional supplement, they don't really need to have any proof of efficacy, which is the most important thing, and then second to that, any proof of safety. Mm-hmm. So in terms of patterns of use, for example, there's a massive increase in the number of people using supplements, not only in the sports industry. The weight loss industry is also a very lucrative market, and also supplements to improve health. And of course, your athlete is really sort of enticed to use these products not only to enhance performance, but to enhance health and to create bigger muscles, lower body fat. And as such, you know, more people are using it. And we've seen an alarming increase in the number of ill health effects related to supplement use, and also an increase in the number of athletes testing positive. Right. In the insert, we heard about the term contamination, and yes, that is a big issue. But an even bigger issue and trends nowadays is that, you know, it's not only the banned substances that as such create a problem and can let you test positive, but for the general public who use these things for the same reason, to lose weight or to build muscle, in children as well, in school-going children who are enticed to do it for those reasons, we see that you know, there's increase in liver injury. There are people who die from it. There are people who have heart attacks, and really it's not just related to banned substances. It's also related to these products nowadays containing prescription medication that shouldn't be in a dietary supplement and that shouldn't be taken uncontrolled. And another area that the general public don't always think about, that even seemingly harmless ingredients like vitamins and minerals, if you take it to the degree that the supplement manufacturers entice people to take it, you take in large dosages, which actually creates imbalances in itself. Right. It can actually impair your immune function. It can lead to toxicity. And another big sort of interesting area of research that has emerged is the impact of these things on exercise and training adaptations.
All right, we'll come back to that.
For the sports person...
Yeah, sorry to interrupt you. We'll come back to that. Let me just invite comment from our studio here in Johannesburg. Okay. You deal quite a lot with youngsters. You go around, you know, educating them on training methods. Perhaps let me hear it from you. What exactly do you do with youngsters out there?
All right, just to go back a bit, I won the SA Natural Heavyweight title 4 times.
Yeah.
There's different bodybuilding associations right here in South Africa. The naturals we do, besides urine tests, we do polygraph tests to determine whether you're drug-free or not. As far as the schools are concerned, for the past 10 years, I've been lecturing on steroids and the dangers of steroids and recreational drugs, including some of the supplements that may contain banned substances. And it's a huge problem. You see, everybody wants to look like Superman. And unfortunately, nothing in a bottle, nothing in a capsule form will give you muscle. It's hard work. In fact, it's smart work. Yeah. It's taken me, I'm training for approximately 30 years now. And
so basically you're saying that you've become a world champion in what you do, bodybuilding, without using any drugs or supplements, and you just use natural training.
As far as the supplements are concerned, I think they do play an important part, but it's small quantities, and most of it actually comes from nutrition. Yeah. If you're not eating correctly, no matter what you put in your body, whether it's in a form of capsules or whether it's a creatine or whey protein, it's not really going to help you. Yeah. Sleep, so important. In the past, I've used things like multivitamins and minerals, vitamin C, antioxidants, amino acids, which are so important for recovery. No supplement is going to make you grow big muscle. And that's the message that we've got to try and get across to youngsters out there. It's a combination of things.
A combination, okay.
Yes.
Now, let's get back to Cape Town. Dr. Amanda, you sounded like you're painting a very bleak picture on supplements in general. Is there anything such as a safe supplement?
In theory, yes. Practically, for a consumer walking into a shop, there isn't really such a thing. And the reason I say that is that, you know, you get these messages from the supplement manufacturers and the retailers that it is safe, it is tested, it is clinically proven, and yet when you actually drill down into it, very, very few, and they regard it to as less than 1% of what is on the market, has really been tested for efficacy.
All right, we'll get back to the testing aspect. We've run out of time, unfortunately. Just in about 15, 20 seconds or so, you consult for the South African Institute for Drug-Free Sport, and you were instrumental in putting together the SAID's position statements on nutritional supplements. In about 15 seconds, just in a nutshell, what is that position statement about?
The position statement is really against the indiscriminate use of supplements. So if you think that your diet isn't sufficient or your needs are too great, the real path to follow is get to speak to a dietitian who's independent with sports nutrition experience, who can really identify where your gaps are and help you identify a low-risk supplement.
All right.
Don't be taken in by supplements being sold as safe. Rather speak to a professional who can really help you identify what safety means and finding the right level of supplementation together with a healthy diet to meet your needs and eliminate some of the risks.
Okay. I'm afraid we're going to have to leave it there because we've run out of time, unfortunately. And I just want to thank you very much for your contribution. And that was Dr. Amanda Klassen-Smithers from Cape Town. Now, what role is the supplement industry playing in the fight against doping in sport? We find out after the break. Please stay with us.
Have we seen the last of you in politics?
I don't know. No, I'm just okay now with the work that I'm doing. Let me just do one thing at a time. So I don't have any plans for politics.
Watch Question Time with me, Mpho Tsedu, Monday to Thursday at 5:30 p.m. on the SABC News Channel.
Groei, maar ik is een kapst. Ja, de paar bezig. Kom.
Right, if you just tuned in, this is Health Talk on SABC News. Now, the sports supplement industry is worth billions of rand in South Africa and globally. There's intense marketing of nutritional supplements, and more elite athletes are seen acting as brand ambassadors for some of these products. However, the disturbing reality is that athletes continue to test positive for banned substances in sport as a result of ingestion of contaminated supplements. Take a look at this insert produced by Tando Ngumalo.
Doping in professional sport is not a new phenomenon and has been happening for a long time. The practice unfortunately happens in many sports, and the products used by dopers are often not illegal, meaning that it's not a criminal offense to take them. However, following a string of liver failures and severe illnesses linked to the dietary supplement Oxy Elite Pro, the product that was pulled from international shelves and was until recently also being sold in South Africa. Oxy Elite Pro contains the stimulant methylhexanamine, commonly known as 1,3-dimethyl or DMAA, the use of which is banned in professional sport. The supplement is currently being investigated by the Medicines Control Council in South Africa. In addition, methylhexanamine or DMAA, which has been linked to a number of deaths, is still used in over-the-counter supplements without any warning to customers. The regulatory status of DMAA differs from country to country.
We cannot bury our heads in the sand about sports supplements to say that, you know, it's just strict liability and don't take it. It is out there, it's in the market. Athletes, parents, the sporting public are asking questions. We want to take this. Does it work? Is it safe?
As the supplements industry is unregulated, the potential for companies with poor manufacturing practices to sell their products to consumers is widespread. Although the Medicines Control Council of South Africa monitors the manufacturing of certain but not all supplements products in South Africa, it is difficult to monitor the safety of products that are imported into the country until after a safety warning is issued by the originating country.
Supplement companies and manufacturers have to work closely with these independent laboratories. These laboratories can provide expert advice on the sourcing of raw materials and on the manufacturing processes to avoid cross-contamination. It's all about controlling the risk. It's all about clean sport.
This means that, unfortunately, until such time that the supplements industry is better regulated, consumers are unaware of the hidden dangers in such supplements and must therefore take all necessary precautions to ensure that their health is not at risk.
At the end of the day, we're trying to make these sporting greats or prominent these sporting greats that are emerging aware of the fact that they are responsible for what they take.
In addition, it's not just the consumer who may be at risk, but the professional athlete as well. The only way consumers can be guaranteed the safety and quality of ingredients that many sports nutrition and supplement products claim to contain is to ensure that their products comply with various good quality standards. Products that are manufactured in an approved Medical Control Council licensed facility that has also been certified for current good manufacturing practice are potentially much safer.
As a major retailer, we see the responsibility on our shoulders to make sure that the customer, our consumer, gets what is on the label in the product, and that the product doesn't have any contamination.
In addition, the only way a supplement can be regarded as safe from banned substances is if the entire supplement batch is tested and cleared by an accredited anti-doping laboratory.
All right, we continue our discussion on supplements, and we still have Martin Dewey in our Johannesburg studio. But we're joined from our Cape Town studio by Dr. Harry Steinman, who's a member of the Food Legislative Advisory Group, or simply FLEG. Dr. Steinman, welcome to Health Talk.
Thank you very much.
All right. Perhaps for the viewers, I might just add that we had extended an invitation to some of the top manufacturers and suppliers of supplements, but unfortunately, none of them were available for this interview. We'll carry on nevertheless. Dr. Steinman, no matter what we say, you know, supplements are there in your face for everybody, okay? And
yes,
all athletes, or maybe not all, but almost all athletes use some form of supplement. And the issue, basically, is that of safety around particularly testing positive for banned substances, just apart from other health issues with some of the, supplements. Now, let's talk a little bit about labeling of nutritional supplements, because this is an area of big concern. Your opinion, please.
Right. I think we have to understand that a lot of the supplements are actually really magic in a bottle. They use magician's tricks. They use bright labels, they use very fancy terms, and they use a list of ingredients that in itself appears to give the product a reputation that it must work. They have logos on, and they might even say it's free of banned substances, which I agree is critically good to know. But if one looks at the ingredients, it could be that they're used in dosages that are very, very low. So even though the ingredient is present, it's in fact going to do nothing. Secondly, the ingredient might be absent. Or thirdly, even if the ingredient is present, it might have absolutely no efficacy at all. Many of these products contain ingredients which have never been shown to have any benefit to humans or athletes together, in combination or individually. The other aspect of it too is that we focus a lot on the safety of the banned substances, whether they're present or not. But many of the ingredients in these products have never been tested for safety in humans in combination that they are found in these products. So we're talking about risk at a great level. We're talking about innuendo that we give an impression that these products have benefits which they don't have. And so we're dealing with really a big marketing drive to convince the consumer that there is efficacy. One of the tricks that is used, for example, is taking one or two ingredients, combining them, and then claiming that they are a patented formulation, when in fact they are just a mixture of 2 or 3 ingredients which we would normally expect to find in these products. So there's a lot of pseudoscience involved in the marketing of these products.
All right. I mean, clearly there's 2 issues here. It's the marketing on the one side, and is the accuracy of the ingredients. I mean, just the simple notion that what you see on the label may not necessarily be what is contained in the supplement. However, without wanting to, club all of these into one basket, there are some manufacturers and some retailers who will say that they have very good quality control measures in place to ensure accuracy. But again, it unfortunately cannot be at the same standard as with other pharmaceutical products, for instance, because of the differences in the way that they regulate it. Now, how do you think we can get around this problem of ensuring that the labeling at least is accurate?
That is the problem, because it really depends firstly on the trust of the manufacturer, and often the retailer is not often the manufacturer, it's at a different plant, a different company. So there has to be some regulation, there has to be testing of all the products, and that's not always happens. When the testing occurs, it's often just to ensure that there's banned substances. I know there are some companies that go further. They test to make sure that the protein levels are fine, that the microbiological standards are fine. One of the important aspects of all law is not just to protect the consumer, but to create a level playing field for the manufacturers, and that is essential. Because if there was a good law in place, it would insist that all products, every single product, is tested along the same range of quality issues. 1, is the ingredient in at the dose that they claim it's in? 2, is it microbiologically free, etc., etc. At the moment, there is no law. So one manufacturer can make his product in a kitchen sink, and another one could be making it in a very, very fancy laboratory-style manufacturing plant.
Yeah, just the last question to you. I mean, how can these laws or regulations be passed and implemented in such a way that, they're practical and they're not, affecting business in general adversely?
The making of a law is a long process. It has to have political will. So you have pressure from consumers, you have pressures from the industry, you have pressure from politicians, from scientists, but it depends completely on the regulator. We've known for more than 15 years, we've been waiting for the Medicines Control Council to bring out regulations controlling complementary medicines, of which these supplements will fall under. That only came through in November last year, but for this specific area, there is still no legislation, although there has been a draft put out recently for comment till the end of this year, which might have some role in controlling these particular products.
All right. Well, Dr. Steinman, unfortunately, we've run out of time, and I want to thank you very much for your contribution. Perhaps we'll have more time next time to delve quite deeper into this subject. Wayne, I didn't get, a comment from you, just in the 30 seconds. Your opinion on the labeling of these supplements?
In the 12 or 13 years that I've also used supplements, I've used in small quantities, I found that there have been some suppliers that have made false claims, and it's really scary if you don't understand nutrition. I'll give you an example. Many of the supplements say that they haven't got sugar in, and yet they put in a sulf-MK, which is 200 times sweeter than sugar. And it just doesn't make sense, you know what I'm saying? But besides the banned substances and everything else, I think in a nutshell, the gentleman previously covered everything that we need to cover.
All right, then let's leave it there. Okay. When we return, we'll look at how nutrition can help enhance performance in sports. Please don't go anywhere.
What is wrong with African players? Why are they not winning?
Our officials, they don't look at the bigger picture of players being happy before they go to the pitch, because mind game is very important.
Seek ye first the goals. I am playing the tactical strategy on the field of play, and all other things shall be added onto you. Don't put money before.
African coaches, did they do well?
I think so far they are doing well.
I do not agree. Sometimes local is lekker is dangerous, because I'm telling you, he who cut the road does not know that his back is zigzag.
Ghana proved to be a damp squib.
You cannot go to war with chickens. You go to war with your best commanders.
What will it take for Africa to make it at international level?
Bring professional coaches from anywhere, whether from Mars, Moon, Jupiter, to come and coach and get us the results. That's what we want. You can't be a coach simply because you play football. And Anam, do you have to be a drunkard in order to own a bottle store? No.
Watch Question Time with me, Mpotedu, Monday to Thursday at 5:30 p.m. on the SABC News Channel.
SABC, sharing 20 years of inspiration.
Welcome back. Now we continue our discussion, and still in Johannesburg we have Martin Dewey, and we're now joined in our Cape Town studio by another special guest, Michelle Meltzer, who's a registered dietitian working in sport. Shelley, welcome to Health Talk.
Thank you.
All right. You've seen all the discussion, the inserts on supplements and what have you. Maybe for this segment, let's just focus on how proper nutritional strategies can be used to aid performance or to support performance in sport.
Okay, what I'd like to, bringing it back to food, the focus as we have to is, and we've said it has to be a food-focused approach, which really for the athlete needs to consider a plan that takes into consideration the quality, the quantity, and the timing of food. Food, after all, can give you much more nutritional bang for your buck. You spoke, and the focus earlier was on supplements, and I think we've got to remember that there are only a handful of supplements, a handful that have been shown to have efficacy, shown to make a performance difference, and that difference is only between 1 to 3% in terms of performance. Whereas food can provide you with the basis, but it does require that you have a plan. Food provides you with a myriad of opportunities, a myriad of nutrients besides energy to optimize performance. But it should be individualized. We've got to recognize that we're dealing with athletes in different sports, athletes with different requirements of energy, athletes with different requirements for carbohydrates, proteins, and fats. But having those foods available in the right quantities at the right time really is what performance nutrition is about. It's having a plan and having that food available as well as fluid. And you've got so many choices to manipulate and to utilize and to individualize that can target performance nutrition.
Okay.
So
But
supplements should really be the cherry on the top.
Right. But it's often said that, considering the training load that athletes face and looking at their diets generally, there is no way that what they eat can meet the nutritional, requirements to support the amount of training.
Yeah.
Your comment on that?
Well, that's where a plan is so important, and that's also where food is important, because food can provide so many opportunities to manipulate. If an athlete doesn't have appetite, we'll take the fruit, for example, and turn it into a smoothie or into a puree, but see that it's available. Milk is a wonderful opportunity to get in protein, carbohydrate, and some fat if you need it.
Yeah.
So there are different opportunities to use food, but you have to have a plan.
Okay. And that plan must be given by a professional like yourself.
I would suggest so, because you want it targeted and you want it tailored. Right. And that professional can actually help work that into a person's diet, taking into consideration their training, their periodized training, their medical history, their social circumstance, and their budget.
All
so
right.
there are a whole lot of other factors that should be considered.
All right, fine. Let's invite, at this time, comment from our guest here, Martin Dewey. You have trained for all these years, and you don't promote use of supplements and steroids and what have you.
All right.
Please share with us, your training strategies.
Look, in the 30 years that I've trained, most of my life, I have used supplements, and the main reason why I've used small amounts of supplements is for recovery. The unfortunate thing is that the body when you train, releases free radicals, which are mischievous chemicals that literally eat away muscle up to 48 hours after the workout. So what amino acids do, they stop muscle from wasting.
Just out of interest, who guided you in what supplements to use?
I was really lucky. I worked with the late Reg Park many years ago, and I worked with two scientists while I was out in Europe. Because every question that I asked many South Africans out here, is it possible to become a top athlete without the use of steroids? And everybody said, no, you've got to use steroids, that I spoke to. And then I did research, and I found out that with good nutrition, 80% comes from nutrition, no doubt. Maybe 5 or 10% from supplements, and the other 10% from training. Very, very important. What I've done is, even now that I've spoken to over 300,000 youngsters, my main message is get the nutrition part right. Training, they're not training. People are just not training correctly in the different gyms. In my new book, Slowing Down Father Time, I've even put a grocery list of simple foods that you can buy in supermarkets that will help you recover and build muscle. But it is important to use certain things like vitamins and amino acids and antioxidants. It does play an important part.
But the message is that if there's that need, only a professional
should be given it. Don't just walk into any store and they're not really going to help you. I'm not saying that these guys are not trained, but go to a professional and they'll definitely help you.
Yeah. I'm afraid there's so much to talk about.
There
and
is.
So little time.
There is.
Shirley in Cape Town, thank you very much for your contribution. And Martin Dewey, thank you very much.
Thank you so much for
your contribution. Okay.
Thank you.
These were our special guests, and unfortunately, we've run out of time. And it is on that note that we say we've come to the end of our show. So until next week, same time, please take care. And remember that you can catch Health Talk either on the YouTube channel or catch the repeat shows at 2 p.m. and 10 p.m. tonight. So please join us again for our yet more informative show next week. Have a great weekend.